Hi, and welcome to News 25's Expert Talk. I'm Lori Buhring, and joining us today is Dr. Stanford Owen, who's teaching us about ADD in people 40 and up. Dr. Owen, thank you again for joining us.
Thank you.
Of course. Well, what should we know about ADD in people who are 40 and older?
When somebody presents to me with a history of recent onset ADD and they've never had it before in their life, they didn't have it through school and childhood, they said they just got in the last year or two.
Right.
My intent is always go up for some underlying condition.
Okay.
There are a number of conditions that can impair the brain that you have to identify. Some extremely simple, like iron deficiency from menstrual blood loss or bleeding, hypothyroidism, where the thyroid's underactive, makes the entire metabolism sluggish, including the brain. Type 2 diabetes, especially after 40 and especially in Mississippi.
Right.
When the blood sugar goes up over 160, the brain can't function normally. I call it diabetic dementia. Hypertension, sometimes blood pressure medications or the medications for chronic pain, for back pain or joint pain, muscle relaxants are impairing. And I, of course, always look for signs or symptoms of drugs of impairment, such as marijuana, alcohol,
Right.
Pain medications, things that people are taking on a daily basis thinking they're just fine.
And how does aging affect ADD besides those things?
Aging itself doesn't affect ADD unless you have an underlying circulatory problem or a metabolic problem, but the brain should remain sharp until you're in your 90s. So it's a use it or lose it thing. So if you become inactive academically and in your environment, your brain is going to wither. Got to use it or lose it.
Use it or lose it. I like that. I like that a lot. All right. Thank you so much, Dr. Owen, for joining us once again.
Thank you.
And thank you for joining us on Expert Talk this week. We'll see you next time.